Thanks for joining us today for BRMC's Healthy Connection. Our guest today, Dr. Paul Neis. And please tell us where you are, your clinic that you have, and what your specialties are.
Well, our clinic is up near the hospital. It's on the end of Beard Drive with my partner, Dr. Monty Barker, and our two audiologists, Dr. Deborah Baker and Monty Harden. And my specialty is ear, nose, and throat, and head and neck surgery.
Okay. Tell us more about that.
A lot of people don't know all of the different areas that we cover in our specialty because it has changed over the years. Maybe 50 years ago, if there was an ear, nose, and throat doctor, they were mainly just doing things like tubes and tonsils and some nasal surgery. But it has been an evolving specialty, and we cover all those things like everybody knows about. Tubes in children's ears, taking out tonsils and adenoids. We do nasal surgery for breathing, chronic sinus surgery. In association with that, we do allergy treatment. So we do inhalant allergy. We do testing and shots for that.
I bet you've been busy this year.
We're busy every year.
Yeah.
There's something all year long around here. And we have lots of everything you can be allergic to. We handle everything related to the ear, whether it be surgery on the ear or in conjunction with our audiologist, care of hearing disorders and balance. We take care of head and neck cancer. So any cancers...
Now that was something I did not know. That was new. Something that people would not be, I'm sure, aware of.
Yeah, so any cancers in the head and neck, neck masses, but that includes skin cancer. In conjunction with that, part of our training is in plastic and reconstructive surgery. So we can not only remove the cancers, but we can do the reconstruction for that.
See, this is something I had no idea.
We handle the voice and the airway, and handle swallowing problems. Just most of the medical problems to do with the head and neck and the surgery involved with that.
I know with our relationship that has been as you're medical director at BRMC for our sleep lab, and I know that from that particular area, the various things that go on, and I'm going to kind of jump around today, if you don't mind, and tell us more about what's going on at the sleep lab at the hospital. Okay.
Well, just for a second, I will touch on, why am I, as an otolaryngologist, doing sleep medicine?
Thank goodness I don't have to pronounce that today.
But we have always been a part of the treatment of breathing disorders with sleep because we handle the upper airway. And where this really got started, this is a new area of medicine. And it was in the 1980s when I was going through my training. It was still very new. What do we do with these people whose airway closes off when they sleep?
And many wives, I'm sure, were coming to you saying, please do something about my husband snoring.
Yes. So we were an integral part of this whole system from the beginning. Well, it came to the point where there were so many sleep studies being done, that became a major component of sleep medicine. There are various specialists that do read sleep studies, but people in my specialty are some of the doctors that became involved in that. So actually what I did 2 years ago, even though I've been reading sleep studies here since about the year 2000, I went back and pursued a subspecialty, so I'm board certified in sleep medicine also. So currently, then, I am the medical director for the sleep lab because right now there aren't a lot of board-certified sleep doctors in the country.
I think you're the only one in this portion of the state.
Yeah, in north central Arkansas, I'm the only board-certified.
And we're lucky enough to have you. So.
Well, thanks. I'm glad to be here. But the sleep lab is really coming along, and we are going through the process this year of doing what's called accreditation. Okay. It doesn't mean that we're going to be any better or do anything differently than we have, but we will have the credentials that many people feel are important. It's like being board certified.
Sure.
It's somebody saying, we have checked you out and we know that you do everything the proper way and are what you say you are.
So
and
here's the hoops, jump through them, and we'll give you the certification.
exactly. Fill all the paperwork out
Sure.
and have an on-site visit and interviews. So hopefully that will all be completed by the end of the year.
That's wonderful. That'll be just one more thing that we can be even more proud of. So to have that certification, it really is, because people are doing comparison shopping, and I think that's the value to many of the certifications. They, when it's time for them to have care, their parents to have care, their loved ones to have care, they don't know, so they do go shopping on the internet oftentimes, and it is great to have those certifications to be able to say, no, yeah.
And that will be one of the things they'll find.
Sure,
and,
exactly.
And I will say the technicians and everyone involved with the sleep lab up there are the ones who have mainly been doing this work and are responsible for the quality of the work in the sleep lab. Karen Ezell, who's the technical director of the sleep lab, just works night and day and is doing a wonderful job. And all of the technicians that do it are very skilled. We're very fortunate sometimes who we end up with in an area like we are. Some people think, oh, Mountain Home, Arkansas is out there in the middle of nowhere. We have people in most areas of work around that hospital who are as good as anybody anywhere in the country.
They could be any place, absolutely any place in the country, but have chosen to stay here oftentimes because of family and friends and the beauty of the area, the wonderful school systems that we have, the lack of crime. I mean, we could go on and on as to the reasons why, but we are truly blessed that we have all of these wonderful people that choose to work in this area, just like yourself. And
well, that's why I'm here. And when I came down and I saw this hospital and my partner showed me around, we've been happy ever since.
Yep. How long have you been here?
Since 1991.
Wow. It's a long time.
Yeah.
So talk to me also about something about this, whether it's for coming in for something with the ears or something with sleep lab. Do people need a referral on this?
No, and that's a question we often get.
Yeah.
People think that they have to have a referral to get into our office. Anyone can make their own appointment for our office. Now, I will say some people's insurance is set up such that they have to have a referral from their doctor, but that's an insurance requirement. That's not something we say you can't see us without it. However, if the insurance requires it, their insurance won't pay for it without that referral.
Is that something that, not to put you on the spot in any way, but if somebody called your office, that probably someone that there could answer their question based on what insurance they had in most cases?
Most cases,
yeah.
Usually we know
which ones. There's obscure insurance that we don't know, but yeah.
Usually we know that, but hopefully the patients pay attention and know that they have to have a prior approval.
Hopefully they know a little bit about their insurance policy. I know sometimes at the hospital we run across folks that don't have a clue what's in their policy or what's covered or what's not. So,
and sometimes it can be confusing.
Yeah, and the entire healthcare arena right now is very confusing. So that we'll all just see what the future brings for all of that. But if a patient, let's say, and I use the example of someone with blocked airway, and I called it snoring. I don't know if that's correct or not, but they had a snoring condition and called your office and went through met some sort of criteria that they really would be a good sleep lab candidate. What would be the next thing that would happen?
Okay. Well, and you hit on it. The first thing is to do some history and hopefully a physical exam and decide who likely has sleep apnea. Because there are a lot of people who snore who don't have sleep apnea, but virtually everyone who has sleep apnea snores.
Okay.
So it's one of the signs, but it's not the only sign. So what we would do is evaluate them. We would make the arrangement for the appointment for the sleep lab. They would go in at the hospital, and the sleep lab sits at the top of the hospital in a quiet area. They have 2 lab rooms.
I've seen them. They're beautiful bedrooms.
Yeah, they're like a nice hotel room. And they come in probably 1 to 2 hours before they would normally go to bed. They're hooked to some monitors, and then the technician monitors them while they sleep, and the next morning they get up and can go to work the same day. It's just like spending a night in a motel room.
Okay. We need to take a short break. I want to hear more about this as soon as we come back. Don't go away. This is fascinating stuff. I want to hear more about sleep apnea, what some of the signs are and symptoms, and the difference between sleep apnea where you actually stop breathing. Okay. Don't go away. We'll be right back.